Everybody, how you all doing? I'm Dr. Samal Noria, a pathologist. So I'm here to give you some important tips for your examinations, especially USMLE and BME. So let's do some hematology concepts today. Hello everyone, so let's discuss about sickle cell anemia today. So first of all, what is sickle cell anemia? Sickle cell anemia is an autosomal recessive disorder that arises due to a mutant beta-globin chain, most commonly caused by a glutamate to valine substitution at position 6 on chromosome number 11. This results in an HbS variant of hemoglobin rather than an HbA variant, which is the normal adult hemoglobin. An interesting finding here is an increased incidence of this HbS allele within the African or Mediterranean heritage, as this is thought to be protective against malaria. And you very well know the African and Mediterranean regions are endemic for malaria. Sickle cell disease occurs when an individual has two HbS genes and is known as a homozygous, or it is known as HbSS form. It could be one HbS gene with another mutant beta-globin gene that becomes a compound heterozygote. Most commonly, compound heterozygotes comprise of HbS beta thalassemia and HbSC disease, whereas in sickle cell trait there is only one HbS gene present. Now coming to pathophysiology of this disease, at low partial pressures of oxygen, the deoxy HbS polymerizes, leading to formation of rigid crystal-like rods that distort membranes, and this leads to the formation of sickles in the circulation. Now this sickling is aggravated by various factors including acidemia, increased carbon dioxide, increased 2,3-DPG, fever, or osmolality. These fragile sickle cells then further cause injury in two main ways. Firstly, the fragile sickle cells hemolyze and cause nitric oxide depletion. Secondly, they lead to occlusion of smaller blood vessels, and that leads to hypoxia and ischemia-reperfusion injury. The HbAS form, or the sickle cell trait patients, they are usually asymptomatic, whereas the homozygous or HbSS disease can be serious and lead to a chronic hemolytic anemia, jaundice in the first year of life, growth retardation along with skeletal changes, and splenomegaly in childhood and splenic atrophy in adulthood. Important clinical correlate here is that functional asplenism leads to increased susceptibility for infections, most often by encapsulated organisms. Few examples include streptopneumonia, Neisseria meningitidis, H. influenzae, and Salmonella causing osteomyelitis. Homozygous sickle cell disease patients often they present with an acute pain episode. Now this could be one important presenting feature in a question in your USMLE or NBME exam. Another acute event known as aplastic crisis is caused by a sudden decrease in red cell production, and this is associated with parvovirus B19 infection, which transiently suppresses the bone marrow. Another crisis known as splenic sequestration crisis is usually seen in children, where a significant pooling of blood is seen in the spleen, and this results in acute hemoglobin drop and could lead to shock. Another crisis is, of course, the vaso-occlusive crisis that leads to infarction and further leads to ischemia-reperfusion injury, especially in the back, chest, abdomen, extremities, may present along with fever and leukocytosis. This can also cause a stroke or a silent myocardial infarction, so be cautious if the patient in your question has a stroke or MI at a very young age. This could also be precipitated by infections, dehydration, rapid change in temperature, pregnancy, menses, or alcohol. Another important feature is acute chest syndrome. This arises due to vaso-occlusion in the pulmonary microcirculation, and the patient will usually present with chest pain, dyspnea, and lung infiltrates. Now, to investigate this condition, firstly, you can do a sickle cell prep, Now, this is a preparation that detects sickling of RBCs under a microscope in response to oxygen lowering agent, for example, a metabisulfite. Another thing that you can do is HB electrophoresis, and this hemoglobin or HB electrophoresis will help you distinguish between HbAS, HbSS or HbSC and other variants. All newborns in developed countries, of course, are always screened for sickle cell disease. Now finally, for the treatment part, we begin with genetic counseling, and for HbAS variant, usually no treatment is required. For HbSC, treatment is dictated by symptom severity. For HbSS or the homozygous disease, we use folic acid first of all to prevent folate deficiency, and we use an important drug for treatment in this condition, that is hydroxyurea. Now this hydroxyurea enhances production of HbF. So now the presence of HbF in RBCs decreases polymerization and precipitation of HbS. Further treatment of vaso-occlusive crisis is done by providing supportive care. So supportive care is by giving oxygen, hydration is done to reduce viscosity, acidosis is corrected, and you can prescribe analgesics or OPAs to relieve pain. An indication for exchange transfusion is severe disease with complications like very low hemoglobin or acute chest syndrome or aplastic crisis or hepatic or splenic sequestration or maybe stroke. Antimicrobials often used for suspected infections, and important part of the treatment, as you might have now guessed, is to prevent the crisis. Now prevention of crisis revolves around first of all establishing a diagnosis, then avoiding conditions that promote sickling, for example hypoxia, acidosis, dehydration and fever. Next is vaccinating a child during childhood for pneumococcus, meningococcus or H influenza B vaccinations. Prophylactic penicillin can be used for age group 3 months to 5-year-old children, and always advise your patients to maintain a good hygiene, good nutrition levels, and provide your patient with a good social support. Finally, your patients need to be regularly followed up for a regular checkup. So this was all for sickle cell anemia. See you in the next video. Thank you so much. Hey everybody, thanks for watching the video. Do comment and subscribe. If you like the video, press the like button. Thank you. See you in the next video.